Hello, good evening.
Hello, good evening, good afternoon. Actually, it's good afternoon here.
Okay, good afternoon. Okay, so Dr. Mariam, how are you?
I am good. How are you?
Yeah, I'm good too, Alhamdulillah. So, Dr.
Alhamdulillah.
Mariam, you know that Med Exam has started. It's a very great initiative and it is
Hmm.
exam podcast, and you are our very first guest in this series.
Hmm.
So,
Okay.
we, the team Med Exam, welcome you from the core of our heart. And
Okay, thank you. That's an honor for
so,
me.
You're welcome. So, Dr. Mariam, students are waiting for your introduction. Please introduce
Hmm.
yourself, who you are, from where you are graduated, and from how long you have been in UK, from how long you have been practicing. So these are all the basic questions which I was getting before that show in my DMs. So please
Hmm.
introduce yourself.
Okay, so my name is Mariam, as everybody knows. So I graduated from DG Khan Medical College, and I graduated in 2018. So I did my house job. I completed my house job and got all my degree in 2018. So things started from there. Initially, when I started a house job, I planned, me and my husband both planned together to move to UK at that time, and we were giving exams. So we moved to UK in 2021. We clear all the exams in all this period because of the COVID. There was some delay, but things have been fine. And I am from Pakistan, as I told, and I belong to Gujranwala. I graduated from Dera Ghazi Khan Medical College. So my journey in UK started in April and 2021.
Okay, Mariam. So that's there comes a very first question like, why UK? Why only UK?
Okay, so the answer to that is because I think I was destined to come to UK. Basically, my husband wanted to go to America, want the or do all the USMLE, and but at that time when we started to give the foreign exam, I was in my house job. That was 2018. At that time, my college was not recognized, basically. So I would consider it as a blessing in disguise, to be honest, because I'm very happy and contented in UK at the moment. Initially, UK was not my first choice, to be honest, but that was Allah's plan. So I'm really happy and I'm really satisfied with where I am today.
Okay, that's very good.
Mhm.
Because the thing is, you should be satisfied for what
Hmm.
the God has planned for you. So this is
Mm-hmm.
the very good thing,
So
Mariam.
yeah, so there are
Yeah.
reasons for that, but I can answer that later on. Why I am saying this, that I'm happy and satisfied. There are a lot of reasons for that as well. But yeah, I can answer it later on when we will ask further questions.
Okay, so there comes another question. Like, from how long you are been living in UK? You have told me that from 2021 you moved to UK, you and your husband,
Yes.
and
So
so
it
it
has
might
been
be
2 years.
2 years.
So it has been
Okay.
2 years. Yeah. Hmm.
Okay. So, Mariam, can you please tell us actually something about life in UK and being a Muslim as well as being a Pakistani? So, what
Hmm.
do you think that life about UK?
So, as I told earlier, that we were destined to come to UK, and that was a blessing in disguise because this is the most important thing. I'm not
Mm-hmm.
sure about other countries because I've not been there, like US or Canada. But things when I came to UK, my first job was in me and my husband got first job in Birmingham, and so when we landed there, the most important thing is I didn't get any cultural shock. The culture is approximately like it's very close to Pakistani because there's a lot of Pakistani population in Birmingham. So
Mm-hmm.
being a Pakistani, it's not that different. You can get everything what you want. You're like we are the food lovers, so you can get every kind of food or whatever you
Yeah.
want. So you can get being a Muslim, as you told. So there are very good mosque, very good Islamic institution you can go to, and you can learn about Islam. Even when I was in Pakistan, things were not that easy to get access to. What I would say, there were a lot, but they were not that easy. But in UK, because you pay more attention to your religion, you pay more attention to your culture. And I'm a mother of a son. He's 3 years, so he's 3 years old. So that's also my main incentive to get him closer to the culture, to get him closer to the religion. So that's why now I think that UK was a very good place to come in. There are two reasons: because it is closer to Pakistan,
Okay.
You can plan your trip whenever you want. It's just a 7 hour direct flight, not that far. And the second important thing, I'm comparing to US. And the second important thing is because of you will, there are very lot of places here like Birmingham, London, and lot of other Manchester. If you will, if you get a job there, you will have no cultural shock, and there were a lot of good places you can take your children for the regular religious activities as well.
Okay, that's very amazing, Mariam. Like the things you
Hmm.
have told us about the UK, that these are very amazing. So,
Hmm.
have you ever faced things like racism and extremism? So,
So,
there is anything like that?
to be honest, if I would say it, racism is what we define racism as. If I will say that, because it's not like if I was working in Pakistan, or if I would have been working in any other part of the world. So I worked in Pakistan for 2 years as well. 1 year was a house job, and 1 year was as a medical officer. So if when I was working there, I faced racism there as well in different perspective. I was a mother, I was pregnant at that time. I have to quit my job in a private hospital in London, sorry, in Multan. I was working there because of racism I faced because I was pregnant at that time. So racism is what you define that. And if you will ask me particularly in UK, so to be honest, no. My answer would be no. And but somehow, like, you can face racism at your work at any place. Like, I belong to Pakistan, but I told you I have to quit my job because of the racism I face.
Okay.
So it depends on you how you define racism. For me,
Okay.
not letting women to work at their place because of their normal, they have to go through process, is a racism. But if you will consider as a racism being a culture, it depends on you as well, like how you're working at your
Mm-hmm.
place. For me and my husband, I think for 2 years, no, we have not faced any racism, to be honest.
Okay, that's really very good,
Mm,
Mariam.
mm,
Because there are a lot of aspirants who wants to move to UK or any of
mm,
the other
mhm.
European country, but the first thing that came in their mind is like racism. We have heard that there is a
Mm.
lot of racism, and being
No.
Muslim, we are not getting job, we are not getting
Mm.
prioritized in any of the field. So these were the basic questions by our aspirants. So that's why I asked you this.
So, if you are
So
particularly concerned about getting a job or building up your CV, being an IMG or being belong to another religion, I would say a big no. That just depend on your experience and stuff. There is on particular on that side there is no racism, to be honest. It just depend on
okay.
experience.
So that's very good thing about UK. So,
Mm.
Mariam, which is the best thing and the excellent thing which is very attractive for you up till now in the UK,
The
regardless
working
of your
environment.
job? Yeah.
The
Okay,
working
that's very good.
environment. Working environment is very friendly. It's very supportive. If I want to get like, because as I told, I have a child. We don't have any extended family here. It's just me and my husband living here with a son, and both working full time. So things get difficult for us. But there are a lot of employment rights here. Being an employee, you can ask for, if like, if my child gets sick, he goes to nursery. If my child gets sick, they will give me leaves without without asking other question. I have heard about my from my other friends. They are living in different, like, they're living US or Canada. So things are not that favorable being a family. So for me, I think the working environment, even in Pakistan, when I was working, my son was born in Pakistan, so things were not that much favorable for me. Though I got very good doctors to work with, but still, I think if you're working here, the working environment and is the best thing. I like being moved to UK.
Okay, so that's another good point about UK.
Mhm.
So, Mariam, now I would welcome you to share some words on your efforts and the journey of PLAB.
Okay, so if it's particularly about the PLAB, to be honest, if I would say it was not hard at all, it would be wrong. And if I would say it was very hard, it would be wrong as well. So I have been blessed with a family that was very supportive. I would like to appreciate my in-laws as well. They have been very supportive throughout this journey. I got married before even my house job. So after, like, in the middle of house job, we planned to move to a foreign country, and we started giving exam. So they have been very supportive in everything. Like, as I told, I moved with my husband. So there were 3 exams each like three OET, PLAB 1 and PLAB 2, and my husband also gave OET, PLAB 1 and PLAB 2. I would not say there were not any failures, to be honest. You will face failures. We also face some. You will face some hurdles, but the only thing, if I would say to the people who are planning to move anywhere, they're planning to do anything, the only important thing is just to be consistent. That's what we stick to. We remain consistent. We believed in Allah, that what we are doing is we just give our 100%. We lost hope in the middle as well. We
Mm-hmm.
got some failures, as I told, but the thing was, we never stopped, to be honest. So that resulted in this thing. So it was not very hard, but you get some hurdles. Everybody can get some hurdles when. So my biggest hurdle, or the biggest thing was, and the most hard thing was for me, was to leave my 3 months old son to give PLAB 2 and to come to UK. For that time, it was a very difficult time for me, to be honest. But as I told, I have a very lovely family, a very lovely in-laws. They all took care of my son. But I was the one who was missing him here, and who was not in the state of mind to give exam. But the things went well, and Alhamdulillah, I'm happy that where I am today.
Yeah, the story you shared, that's very hard to leave
Mhm.
your 2 or 3 months old baby. So
Yeah.
you
So
did a very
yeah,
great job, Mariam.
thank
So,
you.
Mariam, can you please tell me about the thing, like there is a Dr. Shanze Sajil, and she have asked us, like, kindly tell each and everything related to PLAB for those who have zero knowledge.
So that's actually a very extensive topic, to be honest. But I can say in general, what you want to know is it consists of three exams. First is OET or IELTS, that comprises of English language testing, and the second one is PLAB 1. That's more like a MCQs exam, more like a theoretical exam. They want to test your knowledge. And the third one is PLAB 2. That's more like a practical exam. They want to test your skills. OET, or the IELTS exam, is particularly happen in all over the world. Before that, when I gave OET, I was not able to give that in Pakistan, but now the people are privileged; they can give there as well. To be honest, I would not be able to tell how much it cost, because when I gave that, the pound and the rupees rate was totally different. So things have changed. I don't remember exactly how much it cost now, but approximately it was. Mm, I think it was 80-90,000 Pak rupees at that time. I'm not sure how is it now.
Okay,
So
okay.
I will not be able to comment on the figure of the price. But for the English exam, you need a preparation of at least 2 months. There are some keys point in it. If you are continuously speaking in English, or you are just paying like spending 2 hours per day, and for 2 months or 3 months, you will ace it. It's not that difficult. You have to just to be consistent. PLAB 1 is the same thing. For that, you have to study for like 3 months, or 2.5 months. You can manage well with your job. That is also another point I like about UK, is the exams you are giving, you can manage with your job. Like USMLE, you don't have to stick to it for 6-7 months and leave everything and prepare for that. PLAB 1 you can manage as well. It depends on the percentage system, because a lot of people are giving. I was looking at the statistics one day, that the people have now, there are three more time children are giving the exam than they were giving at my time. So its ratio is keep on increasing every year. So passing percentage keep on decreasing, because it's a percentage based exam. But still, it's a doable exam, so don't lose hope. And the third one is PLAB 2, that you have to give in UK. You can't give in any. So PLAB 1 you can also give in any part of the world. You can give in your home country as well. But PLAB 2 you can't give in particular. You have to give in UK. So you have to come for that. That is the most difficult and most interesting exam throughout your UK journey, because you have to move out from your comfort zone. You have to move to a different country. You have to find a place. So there are other problems going on with as well, other than just the giving an exam. So but still, it's a doable exam. It's very easy and very interesting exam. There are a lot of academies working here, and just only thing that help you to pass PLAB 2 is just practice. That's it.
Okay, okay, Mariam. There is another question, like, is language test compulsory before appearing in PLAB?
Yes, so you have to meet the requirements for their particularly English, what they set for giving you the exam. So you have to meet the requirement for, and that's a little bit higher standard they have set for the doctors to work in UK, especially for this job. So I think that's 90% or 80% of you have to meet the criteria in every field. So this is very important for you to fill that criteria before you can apply for the other exam. So you have to do the English exam first, and then you will be eligible to give any other exam.
Okay, so there comes another question, like there is there any validity period for PLAB 1, like its expiry or anything like that?
So, as far as I remember, there is no validity period for PLAB 1, but there is definitely a validity period for OET and IELTS. I think that's 2 years at that time, and they have extended after that because of the COVID. I'm not sure if it's still applicable or not. But for language exam, this is a validity period. And I just want to add one more thing here, Dr. Mariam, is that linguistic exam, that's OET and or IELTS, this is the first step, and this is the most hard step where most of the people just lose hope, because it's the people who just clear in the first attempt, they are very lucky, but most of the times you have to give 2, 3, 4 attempts, but you have to keep on going. So you can clear that, but you have to meet the criteria, as I told earlier.
Exactly.
That's the criteria is a little bit they have raised the standard a bit up for the doctors to work here. So you have to keep on going in that particular exam. So if you are planning to come to UK, don't lose your hope in the first exam. If you clear first exam, you have done 50% of your part for getting a job in UK, to be honest, because that I have seen, I remember most of my friends, they were trying to give the move to UK, but because of that exam and then some hurdles, they just stopped. So this is that one is the most important step.
So the message is keep trying.
Keep trying,
Yeah.
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 Okay, that's a very good message, Mariam. Okay, Mariam, after clearing exams and language exam and the PLAB,
Mhm.
so what is the junior most level of doctors in NHS?
So it varies, to be honest. In when you move to NHS, I will compare with Pakistan. You have to do your 5 year of education, like we did there. Same
Mm-hmm.
in UK, you have to do 5 year of education. After that, it comprises of 1 year of house job. Like we say house job in Pakistan, here we say foundation year one, and then there is a foundation year two. So if you have done total of 7 years, then you can get your like full license to work in UK. You can have a license to work in UK, but this is the requirement you have to do being a doctor. So FY1 and FY2, foundation year one and foundation year two, is a part of their degree if they want to complete that. But in Pakistan, it's just 1 year, that's house job. But in UK, it's comprised of 2 years, that's FY1 and FY2. So mostly when people are coming here, they apply for FY2 job, because most of the people have done their house job. If they have not done house job, or if they have cleared their exams in their medical school, so they have to start from the FY1 year. So it depends and it varies from everyone. So FY1 year is the basic house job year. If you have done that, you can apply for the FY2 year. And if you have a medical experience after your house job as well, like 2 years experience, 3 years, or whatever you have, you can apply the job according to your experience. So there is no minimum limit, if I would say. You can apply according to your experience, but mostly people when come here, they apply for the FY2, but it's not necessary. I have seen people securing job as an ST1, that's a grade higher than FY2. So it depends on your experience. Just look for the job according to experience, but getting first job is a bit tricky. So I've seen people taking FY1 post as well, though they have done the house job and they have a couple of months experience in Pakistan. And I have seen people securing ST1 post as well. So non-training ST1 post you can also apply for if you have done 2 years in your home country post your graduation.
Okay. And is it easy to get a training job there? Like just we do residency in Pakistan. So is it possible? And it like it is very easy to secure a training job there.
So training, to be honest, if I would say, Not everybody here is in a rush of getting a training. Like in
Okay.
Pakistan, I have worked there as well, so I know about the system. Everybody was rushing to get a training because that's how things work there. But over here, it's not like for everyone. Number one, you have a lot of options you can carry on rather than just doing the training, just entering into the training post. And the other thing is, if that's the particular question, getting a training, everything is possible here. You can get any training you want. It depends. Like in Pakistan, I remember that when you want to go into a gynae rotation, you have to do a BHU or to get your merit off. So same thing is here. You have to build up your merit for anything. Like if you want to go into the competitive fields, and you have to build your merit according to that. I've seen a lot of IMG securing and working on the highest post in UK and NHS. So it's not like I would say it's very difficult to get in, but yeah, it will take your time, it will take your efforts. So it depends on you when you come here, what you want to choose and how you want to proceed. But still, there are a lot more options other than just doing training
Okay,
here.
so there is another question, Mariam. A candidate has asked, does membership exam help in securing the field they want?
So I have just cleared the PLAB exam, so I might not be the right person to answer that question because I came through a PLAB route. And but I have seen people who have done the membership exams and they get securing the job. But I particularly have no experience in that, so I would not be the right person to answer or say anything about that. But yeah, giving exams, building up your CVs, and building up your experience in a particular field always help getting a job here.
Okay, so as we are talking both on PLAB and membership, so there comes another
Hmm.
question. Which route is better to enter UK? Membership route or PLAB route?
So as I told, I have done the PLAB route, so
Yeah,
I
yeah.
can particularly tell about that. But if I would say, if I were to answer this question in like in short form, I would say better you sooner you come to the place you want to live, longer you want to work is the best thing. So if you are planning to move, or you are to a different country, or if you're planning to live in another country, the sooner you will go there, it's more better for you rather than just waiting later on and doing things later on. So that's what I'm saying as per my experience, because when you come here you have a lot more options and you have to face other challenges as well. Being an IMG, you have to sort other things out for you. So I think sooner you come to a different to a place and sooner you start working. So for me, I would say that the PLAB route, and it worked really well because we started earlier and we moved here because and so it takes like a lot of time to settle into a new place as well. So we are just in the settling process. So we have been in UK for 2 years, so sooner you start your journey, it's good. So if I would have to answer this, I think PLAB route.
Okay, okay.
Mm.
So let's talk about pay scale of doctors in UK. So as you
Mm-hmm.
were telling, like people start with FY1 or FY2, or there are some people like who start with ST1 or ST2 level. So what
Hmm.
you can say about the pay scale according to that, you can say position or grade. So what about that?
So pay scale also varies, Dr. Mariam, to be honest, because it depends on your experience. It depends on the job you're getting. It depends on the it's depend on the area you are going as well. There are some areas like sometimes there are remote areas, they're offering you ST1
Mm-hmm.
post, and they are offering you the pay scale according to that. They're giving you more incentives as well. But if in particular I have to say, FY1 pay scale mostly varies from 30,000 to 33,000 or
Okay.
32,000 per annum, the British
Okay.
pound. And for FY2, mostly the pay scales, basic pay start from 32,000 to 35,000 per annum. But still, I want to add one more thing, is that it varies according to your experience. If you have experience in your particular country, then it can vary. So there is a range in which the pay can go up to according to your experience. So mostly the pay range is from 32,000 to 40,000. So it can vary in any of it according to your experience. But mostly, like when I came here, or like the people who are just doing PLABs in their house job and coming after
Mm-hmm.
1 year, 2 year of their graduation, they mostly get to 32 to 34,000 per annum. but it also includes the out of hours or the bending as well. So if you're working nights, if you're working on weekends, so you have bending on your pay scale as well. So bending mostly consists of 40 to 50% of your pay. Like if I have been
Okay.
paid 34,000 per annum, so I will be paying 50% bending if I'm doing on call. So it will make it up to, I would say, 50% of 34,000, 20 to, 15, 16,000. It will add more pay to my pay scale, and then it will be divided per month, but tax will be deducted after that. That's a
Yeah.
drawback for working in UK. But yeah, it's you will get a reasonable pay. If I would say 2,800 to 3,000 after tax deduction per month in your initial years.
So, Mariam, do you think that it is sufficient amount of money for a family?
Uh, uh, to be honest, it depends on your expenses. The most expensive thing in UK is the childcare. If you have to,
Mm-hmm.
if you have to send your son to nursery, and the second expensive thing is the rent here. So
Okay.
it depends which area you're living in, and if you have a child and he's going to nursery, then I would say it's a bit difficult in the start, but things getting better with time. But if two-person are earning, or if you don't have to carry in expenses of childcare, if only one person is working, it's manageable. But if you have carry childcare, you two people have to work, and then you can bear that expenses as well. But things get easier with time. So I would say yes, it's manageable.
Okay. Okay. So let's talk about some. I like to invite you for having some of the words on timings of the hospital, because it is the most frequently asked question by a lot of
Mhm.
aspirants. Like, what are the working hours, and in which specialty doctors have to invest more hours. So, what do you say
Mhm.
about it?
So, working environment, as I explained in during the start of the this podcast, is that it's very supportive and it's very manageable. And you, if you're just working on the times that in your contract, if you're not doing much locums, like most of the Pakistanis or most of the IMGs, when they come here, they just rush to that. But if you're not doing any locums, and if you're just sticking to that hours that the NHS has offered you, you can have a very good work life balance. I
Okay.
think I don't have much knowledge about that, but if I think that's the best in the whole world. I think so, because it's working just 40 to 48 hours per week, and you get
Mm-hmm.
2 days off. But if they're because of your commitment or because of your on calls, if you're working like on the weekend as well, so in the coming week, in the next week, you will get 4 days off in total. So in
Okay.
14 days, you are just working 10 days, and you will
Okay.
get 8 to 9 days per off per month.
Okay. So
Hmm.
that's very good thing about UK.
And yeah, and you have a lot of annual leaves you can take if you want to move, like 30 to 33 annual leaves you have you on board as well. It keep on increasing according to your experience, but definitely you can get 28 in the start. And the annual leaves don't comprises of your weekends. So if you want to take your annual leave, you can take from Monday to Friday. That's comprises of only 5 annual leaves, and you can take off for total 7 days. So that's
Okay.
a good thing as well. Work, and if you just talk about regular working hours for per day, that's if you're working on that day, it's like you're investing your whole day, because it varies from 8 to 9 hours. It's you work from 8 hours to 9 hours, or sometimes 9.5 hours as well. So per day
Okay,
you're
so
working there.
Dr. Mariam, and do you think that it varies from field to field, like specialty to specialty, or these are fixed
Yes.
working hours for every kind of field?
So working 40 to 48 hours per week is I think fixed for every kind of field, but it
Okay,
varies that which time you're working in. Like if you're working in ED, the rota would be totally different. You will be
okay,
working maybe from 10 p.m. to you're working from till 2 a.m. So rota varies, but the hours will remain same more or less between 40. They will fluctuate between 40 to 48 hours per week.
okay.
Yeah.
And what do you think that which specialty has better chance to secure a first job in NHS? What do you think that, like?
Being getting a non-training job, it doesn't depend on specialty, to be honest. But most people, because it depends on the shortage they have, because mostly ED have more shortage, or the acute medicine have more shortage.
Mm-hmm.
Even trauma have more shortage. So they can be the job that you can apply for in the beginning, but there are other options as well. Depends, like if some hospital has less people in gastro or in cardiology, so they can get there as well. Surgery, I have heard less that people get a job initially in the non-training period, but still there are chances you can get that. Depends on the shortage, to be honest. It doesn't, but
Okay.
because ED has always a shortage for the doctor's emergency, so there are more chances there to get it there.
Okay. So, Mariam, there is a query by Dr. Shahzeb, and he has
Mm-hmm.
asked, like, if one is working in Pakistan as a medical officer in any
Hmm.
of the field, and
Hmm.
he plans to take PLAB, and he wants to move to UK, then how should he or she structured and tailored his or her CV? Like, what are the things in her CV for any of the post to getting job in NHS?
So sorry, I missed your question. So if a person is working as a medical officer in ED in Pakistan,
Not ED, in any of the
in any
department.
of the field,
Yeah.
any of the department. Okay, so the basic thing is, if you're working as a medical officer, you will get a junior job here, or maybe you can get maximum up to ST1. So if you're starting your, if you're planning to come through a PLAB route, or you're coming to the basic, like the non-training job, or you're coming to that route, so you should be sticking to the basic things, like the most important thing: passing cannula, NG, Foley's, these kind of things. Doing surgeries and assisting surgery can help, but doing surgery independently, like C-section, appendix, it will not add much to your CV, to be honest, because they think it's quite unsafe for a junior doctor to do all these things alone here, and
Mm-hmm.
it takes years and years to them to learn these kind of procedure, very basic procedure. Like if you're working in trauma, you have to learn how to do a knee aspiration. You have to do how to put a plaster on, like very basic stuff we do in a house job, the things we do in a house job. So that's the thing you have to work more on. And secondly, you have to it depends on your experience as well, like for how long you're working there. So these are the things you should be sticking to if you're trying to build up your CV. And secondly, the
Okay.
most important thing, sorry, so secondly, the most important thing nowadays for getting a job is that you should have, or you would try to get an experience, like in UK. If you come to give your PLAB exam, you just stay here for some time, get an internship here, and just do that internship. If you have experience of 4 weeks or at least 2 weeks on your CV, or how much you can do here, so that will make your CV a little bit stronger.
Okay, that was my next question actually.
Hmm.
And I was about to ask, like, is it easy to get clinical attachment in UK while on trip to PLAB? And there is another thing about this clinical attachment is, are there some of specific hospitals which are offering seats for clinical attachment? And are these seats paid or unpaid?
So about the first question about getting an attachment, it varies. I mean,
Okay.
at my time, it was not that easy, but things were difficult at that time as well. But it depends on saturation, as become because UK is becoming
Mm-hmm.
more saturated, because a lot of IMGs are giving exam and trying to come here. So it depends on that as well. But there are particular time where the job opportunities are open, that is August and February, because at that time of the year they are rotating their FI1s are going to FI2, so slots are become available for that. So if you are planning to apply a job, February and August are before February and August, like 2 to 3 months before February, you start looking for jobs, because more job opportunities at that time. And the second time period is August, because at that time the new post, or the new year medical year starts. That's a particular time. And about hospitals, so hospitals also, most of the hospitals do offer clinical attachment, and mostly they are unpaid. So it doesn't matter to them, like which hospital they are offering. So it's not adding much to the hospital, because you are not allowed to do any of the, clinical work or something. You have only restriction what you can do, but it just they are not getting, like, they are not getting an extra person to work, so they are not paying them for sure. But now most of the jobs are, before that I thought the hospital I'm working in, it's not offering jobs to the internships, but now I've seen two or three people doing internship there, so they are offering as well. So I think it depends and it varies. I think most of the hospitals are offering internship now. And
Okay.
the last question is, it is easy to get an internship?
Yeah.
Uh, uh, to be honest, if you will keep on trying, if you come to UK and you are living here and you're applying internship, you will get it eventually. And still, as
Okay.
I told, it's a particular time of the year you should look for the jobs internship. That's February, before February and immediately before August. There are more opportunities at that time. But still, you can get in other part of the year as well. If you're living in UK and you have a visa, so it's not a problem for them. So main problem for the IMGs that face here in getting a job or getting an internship is visa. So if you have a valid visa or you're living in the UK, you will get it eventually.
Okay. There is another query, Mariam, which is, does reference matter in getting a job? Like, if you are having good terms with any of the consultant or any of the person who is having the senior post, so does it matter? Does it really helps in getting a job?
So if I would answer this question, having a reference will help you to get an interview.
Mm-hmm.
It will help you to get an interview, but it will not help you to get a job.
Okay.
So it matters in a sense that it will help you to secure an interview, and if you secure an interview, it means you have got the job. 50% of the work is done, so you just, the 50% is left. But to get a push, if you have a reference, or if somebody can recommend you, so it's a very good thing. It also matters in NHS as well, but it will not help you to get secure a job, but it will help you to secure an interview for sure.
Okay. So, Mariam, I have a question by Dr. Rubab Khalid, and she's asking, for PLAB Viva dress code matters as they do for many clinical membership exams. As you told us
So
that PLAB 2 is just a clinical exam. So,
okay.
yeah.
Yeah, so PLAB too, yeah, there is a dress code you have to follow. Uh, sorry. So,
It's okay.
but to be honest, the dress is not the only thing you have to be worrying about on that day. Is there some things you have to follow, like your sleeve should be above your elbow, and you should be wearing a decent dressing on that day. So not a maybe. I would not say a dress code matters a lot, but yeah, you have to follow a particular dress code. Like the doctors working in NHS, they have to follow the dress code. So it's not particularly important thing. I've seen when I was giving my exam, I've seen people coming in their pajamas, to be honest, and they were passing that exam. So it's okay, but
Okay.
it's good to have a decent dressing.
Okay. So, there is an other query, and it is by Dr. Maruk, and she's asking, what should be a daily routine for PLAB takers? Like, I think she's asking about the study timing,
So as
daily
I
study
already
time.
told,
Yeah.
for OET, it depends from exam to exam as well. If you are planning to give OET 2 to 3 hours per day, and the most important thing for all these exams, especially OET and the other PLAB too, is you should have a partner from the very start who is also
Okay.
who has exam date closer to you or with you. And the second thing is who is managing things well, and you both of you can study together. So OET, you need 2 to 3 hours per day according to your whatever your routine is. Just try to
Mm-hmm.
manage 2 to 3 hours for at least two. For OET, 40 days is enough, to be honest, or IELTS. 40 days is enough, and try to do practice daily on daily basis for
Okay.
all these 40 days. And for PLAB 1, you can study alone, so you don't need specifically a partner in PLAB 1, but 3 4 hours per day for at least 2 to 2.5 months, and you so basically you just have to pass an exam. Score doesn't matter, so you can easily pass the exam within, if you are preparing well for 2 months and you're staying
Okay.
sticking to it, and 2 to 3 hours daily. But for PLAB 2, it's a bit different. You have to, at least you have to be giving at least your 1.5 months, 40 to 45 days to PLAB 2, and coming to UK and preparing here, you are not able to do any other thing in those 40 days. So for PLAB 2, it's a bit different, but for PLAB 1 and OET, you can manage well with your job as well.
Okay. So, Mariam, there is another question by Dr. Bilal, and he's asking any recommendation of books we need to study for PLAB?
So OAT, there is because you have to mostly sticking to the past papers. So there is a lot of material available, and things keep on changing. So when I gave it, it was in 2018. So it's 5 years ago almost. So I to be honest, I just prep it from the online courses, online material that was available. uh, Only thing matter in OET is just you should keep on talking in English in your last 1 month. If you're just talking in English, so things will get easier for you. It will not be a problem, to be honest. And just the online material and whatever stuff is available, just try to involve one of your partner and one of your colleague in
Mm-hmm.
practicing that. And for PLAB 1, it's just a
Yeah.
basic knowledge exam. The Oxford handbooks are quite very useful, to be honest. If you want to read any other thing, any book with that, surgery Oxford handbook and medicine Oxford handbook, they have very precise and limited knowledge that what you need for your PLAB exam. You don't want to do any extensive reading or stuff. And then there are very good banks available from where you can
Mm-hmm.
practice your MCQs from. For PLAB 2, to be honest, it's most like a speaking side of OET. So you have to be, the most important thing is you have to be fluent in English in your exam. And that's to be honest, that make 50% of the exam. If you're fluent in English, 50% of your exam is done, 50% of your
Okay.
thing is done. And second thing is you have to that counts for the interpersonal skills. So interpersonal skills matters a lot in your PLAB 2 exam. So it's very difficult for us as well, being IMGs, because we come from a different culture and different we have a different way of talking to patient, and we deal with different things. But if you keep on practicing, you will do that. And still, the if you want to do extra thing, Oxford handbook is pretty much, because management is it consists of some of the PLAB 2 but very little part. So it comes at the end. The basic thing is just taking history, just examining, and at the end management come, and it comprises of a very small part of PLAB 2.
Okay. So, Dr. Wajiha has asked, how can we get a match in surgery in UK?
So again, I'm not the right person to answer that
Yeah.
question. I'm sorry,
I was
because
expecting the same answer.
yeah, because I am not planning to do surgery in UK. Initially, when I came here, I was very into ophthalmology. I really wanted to become an ophthalmologist, but
Mm-hmm.
things changed very quickly because of my son. And I'm very happy where I am now and which field I'm trying to choose. I'm starting my GP training in August, inshallah. So I'm happy with that. So I'm on the GP side. I'm not selected for surgery, but I know very good people here who are trying to build up the merit for surgery. It's not
Mm-hmm.
difficult. It's demanding. You need some time to build up your portfolio, and it's not difficult, to be honest. If you can just build up that portfolio, and it depends on your commitment, how much you can invest on that. So it's not difficult to get any training in UK. I've seen a lot of IMGs. In ophthalmology is highly competitive here. Radiology is highly competitive here, but I've seen a lot of IMGs going there and securing their job. So it's not difficult
Mm-hmm.
at all. It depends on your commitment.
Okay. So, Mariam, as you have told us that you are entering into a GP ship, so can you please tell us about the route and the pathway for entering into the GP ship? So, is there
So
any kind of
GP,
exam for that?
yes. So for
Okay.
GP, you have your 2 years experience done. That's FI1 and FI2. You can,
Okay.
if you have done in your home country, you can apply for the GP ship directly, which I think is quite unsafe, because you should have a experience of the NHS as a non-training doctor before you're entering into a training. People are trying that route as well, directly coming to the GP training. But
Mm-hmm.
that's a little bit unsafe, if I think, because you should get some non-training job, because once you're in the training, you are a trainee, so things get a bit difficult. The other thing is, so you need 2 years experience. When you are done with your FY2, you have your form. That's what we call crest form. That's particularly consists that you have done the basic thing and you have 2 year competencies like FY1 and FY2 done. So you need that form. And the other thing you need at the moment is in a good preparation or a good score in MSRA. That's the exam we give for GP-ship.
Okay.
It's a multi-specialty recruitment exam, so it comprises of other fields as well. It comprises of radiology, psychiatry, and and a lot of other fields. There's a long list for other field that you have to give MSRA. If you score good, you can select anesthesia as well. For anesthesia, you have to give MSRA as well. So for GP, it's the same exam. So you have to give that exam, and then you can you get a score. During COVID, they have stopped interview for the GP-ship, so you don't have to give any interview, just the exam and it's just your crest form, and then you can have your merit you can get a place according to your merit in the UK. So it depends on that. So just two things: a crest form to be signed and give an MSR exam at the moment,
Okay.
but they might add the interview during years, because the COVID has now over in UK, so they will add interview as well. But for at the moment there is no interview, but they might add it later on.
Okay, so Mariam, there is another comment in the comment box, and she's asking what options for radiology. So I think you have told this thing already. And is there any kind of message for the juniors and for the upcoming aspirant for PLAB and
Mm.
any of the foreign exams? So Mariam, what do you want to share with all of us?
So if I have to give a piece of advice, that would be just remain consistent, just sticking to your goal. Don't lose hope in the middle, because you will face some hardship. Everyone, when you're losing hope, just think everyone has a hardship and everyone has to go through
Exactly.
it. Just
Yeah.
remain strong and just remain focused to your goal, and you will reach there, inshallah, one day.
Okay, so that's a very beautiful message by Dr. Mariam. And Mariam, I'm immensely thankful for your gracious presence at our show. And as all of us and along with our students were very excited regarding the med exam podcast, and as it was our first show, so we were hoping that it go very well. So Alhamdulillah, I am very happy with the show, and I have seen the comment box as well. So all the questions which student have asked, I have already asked you. So thank you so much. So is there anything you feel that there should be anything extra you feel that we should cover in our live sessions too?
So
Any
no,
kind
this
of
is a very
advice?
good. So this is a very good initiative. There are a lot of people who need guidance, and I think it's a good initiative that you have started.
Yeah.
Just stick to it and do your best. You guys are already doing great.
Okay, thank you so much, Mariam. Thank you.
Thank you so much.
So okay, very informative. Yeah, I'm receiving comments as well. Very
Mhm.
informative and honest reviews of life here in UK. Very informative session. Very informative session for PLAB aspirants. So all thanks to Dr. Mariam Tabish, and
Mhm.
with the help of her, we have covered all the things and all the queries related to PLAB, because you know that we are running different pages for helping students, but the thing is we are not the one who can provide them a better guidance. So that's why we were planning to start this initiative to invite such guests, so student can solve out their queries. So thank you so much, Mariam, and thank you med exam, thank you the backend team. So I hope that the next show will also be great. And up till now we are not having any idea that who will be the guest, but I'm sure that students who want to take any of the guidance regarding any of the foreign exam will get benefit from it. So
Oh
thank you
no,
so much.
hopefully,
Thank you.
inshallah. Okay, thank you.
Inshallah.
Allah Hafiz. Thank
Allah
you.
Hafiz.